Today we'll be discussing a topic on polycystic ovarian syndrome, because this is one of the most commonest clinical topic that I come across in our regular OPD basis. It varies from young adolescent girls to the reproductive age group women. Usually what happens in polycystic ovarian syndrome is there is an imbalance in the hormones, and that leads to infrequent periods. So normally what happens in the woman's menstrual cycle is we have reproductive organ called ovaries, from where estrogens and progesterones do develop. In the normal menstrual cycle, which can vary from 21 to 35 days, so we do have what is called an ovulation period around 14th or 15th day of the cycle normally. So the eggs tend to release during that time. And in case of a polycystic ovarian disease, what happens is there are all small fluid-filled cysts around the ovaries, and the eggs tend to get released. So obviously there is no ovulation happening. When there is no ovulation which happens, then there is no regularization of the periods in these women. So as the name suggests, poly means many. Cystic is small air-filled balloon like cysts. And because it produces on the ovaries and it presents on the ovaries, it's called ovarian syndrome. Syndrome is nothing but the group of symptoms all put together. So hence the name polycystic ovarian syndrome. So coming to what could be the causes of polycystic ovarian syndrome, but sadly most of the times it's very, very unclear. It could be genetic, it could be because of the lifestyle or sedentary lifestyle changes in our day-to-day activities, and because of stress, because everybody is multitasking in this fast busy life, and causes a lot of mental stress as well. So that could also have an effect on the periods, or any sudden changes in the weight of our body. So suddenly we decide to go to the gym, or we don't, or we suddenly stop exercising or suddenly start exercising. So there can be variation in our periods as well, and changes in our weight as well. Sudden weight gain or weight loss also can also cause alteration in our periods for all of us. So what are the symptoms and signs that we need to really watch out for, and when do you need to really see the doctor? So polycystic ovaries so what regularly happens is there is increase in the male hormones called androgens. Because of increase in the hormones of male hormones in our body, that can lead to a lot of acne. Acne is nothing but a lot of pimples. And also hirsutism. Hirsutism is abnormal hair growth or male pattern hair growth, more on the lips or on the chin or on the chest is a possibility. And also there is what is called insulin resistance in polycystic ovarian disease. So in such a situation, these women are more prone to have diabetes in future, and also cause menstrual irregularities. So what menstrual irregularities can polycystic ovary cause for all of us? There can be irregular periods, there can be delayed periods. So once in 2 months, once in 3 months, sometimes they do tend to have once in 6 months as well, or they tend to get periods only if we give any medication for the withdrawal bleed. And sometimes the periods may be very, very light for a day or two, or they may just have some spotting. So all these indirectly cause an effect on the fertility. So there may be delay in conception in such women. So combinedly, and also weight gain, combinedly looking into all this, obviously this is definitely going to have a lot of psychological issues also in some women. Because of a stressful lifestyle, they may go through a lot of depression, they may go to anxiety, they may go through mood swings, and emotional instability is a possibility with a low self-esteem in all these women. So I would suggest all these women to take care of their mental well-being too, along with all these problems. So these are the signs and symptoms that you need to watch out for whenever you have polycystic ovarian disease, and please do reach out to us in such a situation. So what happens when you come to us? So when you come to us, we take a detailed menstrual history, we check your height, we check your weight, we check your body mass index, and also do a couple of blood tests, and also scan for us to know if at all you are suffering from polycystic ovarian syndrome. Then later we would counsel you regarding your lifestyle changes, because that is the most priority in day-to-day life, and that would take a long way for all these women, along with some medications that we would be discussing about. So to ensure that you stay fit, keep yourself healthy, along with these Physical well-being, emotional, mental well-being is also equally important for all these women. So if you notice any of these symptoms, please do visit us, and then we are there to help you out throughout your process. Thank you.